Hello, my name is Stephanie Allen. I'm the VP of Strategic Business Operations and Performance for BC Housing. It's my pleasure to speak to you today about our work using culturally grounded and trauma-informed approaches to moving homeless folks indoors during the last couple years of the pandemic. I want to begin by recognizing that I'm speaking today from the ancestral and unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I want to offer my respect to their peoples past and present and express my commitment to working in good relations. BC Housing, a little bit about us to start. BC Housing is the provincial housing agency responsible for a range of housing, all the way from homelessness and emergency responses to homelessness up to affordable home ownership. We also provide rent supplements for seniors and families in the private rental market, as well as acting as the licensing and consumer services branch for the province. We work across all levels of government with federal partners, municipal partners, really with the intention of bringing as the much needed affordable housing to the families and households that need it in the province. We work with about 800 housing providers who are not-for-profits. They deliver the bulk of the new supply and operate the majority of the housing in the province. And we also help more than 110,000 households in communities across British Columbia. Now, to start the discussion, I wanted to ground our work in recognizing the different pathways to homelessness. There are structural factors and failures, such as poverty, discrimination of all kinds, a lack of affordable housing supply, as well as the long-lasting impact of colonization and cultural genocide on Indigenous peoples. There's also individual relationship factors that lead to homelessness, traumatic events that happen in people's lives, family violence and abuse, deteriorating health that could range from physical to mental health, as well as people managing addictions. And then, of course, there are systemic failures, which represent the barriers that people face to accessing public systems, people who are transitioning out of child welfare or foster care, who age out and don't have the financial means or supports to live independently, as well as people that are being discharged from publicly funded institutions and systems such as hospitals and corrections. It's really important to recognize that homelessness is not a personal failure. It's not something that denies that the humanity of the people that are in the circumstances they face, and that it could happen to any one of us. What you see on the screen is a photograph from Openheimer Park in Vancouver. You know, as a result of the COVID-19 pandemic, emergency shelters across the province reduced capacity to comply with the public health guidance. We also know there were a lot of people who had been precariously housed or had been balancing very challenging circumstances for whom the pandemic pushed them right over the edge. It was at that time that in both Vancouver and Victoria, there were about over 600 people who were sleeping rough in encampments that were looking to move into housing. So I'm going to talk about the learnings from the Vancouver situation that happened both in 2020 of our efforts to move folks out of the Oppenheimer encampment, as well as this year, this past spring, when we moved folks from the Strathcona Park encampment. You know, in both these circumstances, we really tried to do our best to recognize that the people you see on the screen were the ones who knew best the barriers they were facing to housing, the experiences that they were dealing with, and their own life complexities. And it was on an invitation of the homeless advocates to BC Housing and other partner agencies to sit and to listen to the circumstances that people were facing, the issues that they were being impacted by, the cycles of homelessness that they had already experienced, and what we could do to really evolve our practices to make sure that we were accommodating the needs of folks and setting them up for success when they moved indoors. Oppenheimer Park is situated in the downtown east side of Vancouver. It's a home to many racialized communities and, of course, on the ancestral and unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. It's a community with a strong resilience, with a history of activism and resisting systemic oppression. And we really recognize the spirit of the people that are in these circumstances. So when we attended those meetings, what we learned was that we needed to improve our processes, and that took changing and being nimble. And for institutions as large as ours, that's sometimes a big challenge. But we stepped up to that challenge really by listening to the folks in these circumstances. And I'm going to relate a few of the things that were our critical success factors. First of all was building relationships. We actively listened to the folks that were in these circumstances and to their advocates, and we took the time to build trusting relationships with them. It was a foundation that's necessary when you're talking about marginalized and vulnerable and oftentimes people who have suffered extreme trauma in helping them move indoors. We, of course, take a housing first approach in British Columbia, but there are so many complicating factors that impact people's well-being and their ability to move indoors safely. We also had to understand that homeless encampments provide a bit of an ecosystem to folks, is what I call an ecosystem. There's mutual aid and social networks. There are people looking out for each other and trying to help substance users to make sure they're using with supervision and safety. And also there was a recognition that being together is providing a buffer from the violence that homeless people face when they're on their own, sleeping in doorways and alleyways. It's also about the fact that there are different kinds of suppliers for people who use substances in these circumstances. Some are more predatory than others, and that for people's survival, they do depend on these suppliers. So finding, I think, and sourcing humane suppliers that don't use enforcement tactics or violence is something that people seek in these circumstances. We did a lot of listening and we heard a lot of frustration. And I think that was appropriate for those of us in senior positions to understand how what we were doing was impacting the people that we are supposed to be serving and do want to serve. But oftentimes the paternalistic nature of what we do can sometimes blind us to the needs of people, because I think a lot of times we think we know best. And it was very clear from our communications with people in these circumstances that we really didn't. And that led us to the next key factor, which was developing the moving plans with campers and not for them. We recognized and brought all of our partners to the table. We advocated for this cultural and trauma-informed practices throughout all of our different jurisdictions. And we worked with our team members to evolve our best practices. That included enlisting the support of peers or people who had been formerly homeless or even homeless at the time, who were paid stipends to support cleanup and garbage removal, help people with the communications. So we really recognized that we wanted to support and use funds in a way that kind of provided people with trusted advisors and trusted resources from their own community. It was also important during our moving effort, where we had a concentrated set of days that we were moving folks indoors, to start each day with an Indigenous ceremony and territorial welcome. The words spoken by the First Nations leadership from the Musqueam, Squamish, and Tsleil-Waututh Nations really touched everyone who listened, campers, outreach workers, and even those of us in senior roles. We benefited from hearing about the history of the lands, the history of the peoples in this community, and their long-standing aspiration to live free from the oppressive impacts that colonization has had on First Nations, Métis, and Inuit people. And so this ceremony is something that we really, really valued, and that we put our effort into attending every day. It created a sense of calm throughout the camp and really guided us in our work to hold up to the aspirations of what the work represented. It was also, after that, an opportunity for the outreach workers to visit with the campers, provide that breakfast, and give them the communications that were so critical. What we found is even though there was a public safety order that mandated this move for people indoors due to the pandemic, the postings weren't very accessible and the language of legalese wasn't accessible for the people that were in these circumstances. So each day we provided campers with a moving update that would give them what was happening that day. This was a direct response to the advocacy of one of the camp leaders named Chrissy Brett, an Indigenous woman who we've grown to really respect and collaborate with on these solutions. And so this daily communication flyer was distributed with breakfast, and we were answering the questions that were coming up from the outreach team at the end of our day's debrief. What would happen to my bike? Can I get my things where I'm going? What if I have more belongings than I can take with me? All of those things were things that we communicated. And what we learned from Oppenheimer was that it was also critical to provide hygiene facilities, warming facilities, so that people were not endangering themselves by using unsafe means to warm themselves or unsafe supplies for hygiene. It was really critical. At the Strathcona encampment this year, we provided a warming tent, bathing facilities, as well as fresh water and other supplies. I think it's also critical to recognize and acknowledge the roles of advocates and those who are protesting. As you can see, there's signs here from those who are supportive of people living in encampments, and to recognize that this is very legitimate expression of marginalized peoples across history. Myself, as a person of African descent, know how important it's been for my ancestors, for what they did to advocate for liberation and justice. And we recognize that the same is true for people who are homeless, and in the ways that we need to adjust and evolve our systems to make sure everyone has a safe and supported and comforting home for them. And that also we identify that the exploitation and the role of jurisdictional bodies, the ways that these things has happened, and that we have to minimize that these things have been long-standing, and that it's our job to remove anything that's having a negative impact on the people that we want to serve. Speaking a little bit about the role of safety, where it comes to the fire department and police departments, and that is recognizing that people in authority and people in uniform can have a very triggering impact on people who are homeless. Oftentimes people are homeless have had brushes with the law already. They come from communities that have historically poor relationships with law enforcement, and that the presence of policing can be quite triggering. So we worked closely with the Vancouver Police Department on during the Oppenheimer decampment work to recognize their role, that we wanted to have their involvement, that they attended our daily briefings, and they took an off-site position where they were available if, let's suppose, one of the predatory elements sprung up and took people enacted violence on other people, which we know happens to homeless people more than to most, but that they also weren't very present with any kind of triggering or trauma-inducing impact. And so we really appreciate the role that the Vancouver police played during the Oppenheimer decampment and the respectful role that they took. And it's also important to recognize that the fire department wants to make sure that people aren't using unsafe heating devices, which was why we implemented a warming tent and did our best to minimize any use of any banned equipment in the desire for people to stay warm, while recognizing that they absolutely have the right to warmth and care while they were outside. The trauma-informed case management approaches was really the embodiment of the people that were working on the ground daily with folks. You see on the screen a picture of outreach workers having a briefing. People in the encampments become very known to everyone working on the ground. They know their case history. They know the health supports that they need. They know their circumstances and relationships. And it was through that kind of approach that carried people right through until they moved indoors. You see a photo from the Howard Johnson, one of the many hotels we purchased, over the last couple of years to bring people indoors, and the welcome package that awaited folks. And on the left, you see a photograph of the welcome package that was offered by Luma Native Housing for their space that they were operating, the housing that they were operating, which was focused on providing Indigenous peoples with the cultural supports that they needed. And so we also had to do COVID screening. There was recognizing if people needed safe supply and if they had to get on safe supply. There was a number of factors that went into this work, and I can't speak highly enough about the people who dedicate their lives to supporting those who find themselves in these circumstances and needing housing. The cultural competency in the moving process and in housing operations was so critical for all of us. Indigenous people were representing about 40% of the people in the encampment, despite their population numbers being many, many multiples less. We also had racialized people overrepresented in this encampment. And so it was critical for us to recognize that the kinds of things that you see on your screen right now, like the drumming circle that would arise, was a culturally healing thing for the people that were in this encampment to express and to process the many emotions that come with moving indoors. It's not a simple process, and there's a lot of stigma and challenges that definitely impact people and their apprehension to trusting those of us who are saying that we're here to help. So we just really want to recognize that the work is continuing. This was early days, and we have to recognize our need to make sure that people with cultural needs are getting the support they need. Talked a little bit about the health supports and that we enlisted, and working closely with our health partners who have also been really working tirelessly to evolve their support and their role with people who are homeless. And that included piloting safe supply for people who are using banned substance in their pain management. And so that has had a lot of success. And we could probably talk for a very long time about banned substances and the need to decriminalize and provide a safe supply of pain management for people who are poor and experiencing homelessness. But suffice to say that this work was really grounded in those principles and recognized that mental health supports, substance use, we had everyone was trained up on overdose response, and to make sure that people were moving indoors with health supports wrapped around them. We know that this is not all the way perfect yet, and we have a long way to go, but what we really have recognized is the absolute need for that work to continue. You know, people who are homeless have very nuanced lives. We talk about the numbers sometimes of homeless counts. We talk about the numbers of people living in encampments. But it's so critical to recognize that people's lives are just as nuanced as the lives you and I live. People have pets. They have belongings that are very important to them. Sometimes their most valued treasures, people's ashes of dead family members, precious mementos from their lives. They carry this with them. And to have adequate storage and to be able to bring their things inside is so critical because of the limitations that sometimes storage might present in certain situations and shelters. So it's also recognizing to help people move and in transition indoors that they had the things that they needed. There's also relationships that people were in. They have partners and friendships, and that the maintenance of those social networks when people move indoors is vital to keeping them healthy and safe. So that's it for my presentation. I just want to say thank you so much for the opportunity to speak to you all today, and look forward to your questions, and just really encourage all of us that are working in this realm of supporting homeless people and moving them indoors, that this work must be grounded in the needs of the people themselves, that they are the best ones that know how and what will work for them, and that by spending our time listening and incorporating their voice into our work, paying them as peers to support this work, and creating the long-term runway for their wellness as they move indoors is one of the most important things any of us can do, while recognizing the needs for our institutions to adapt and to change so that we're all serving our communities to the best of our ability. Thank you so much.